Thank you very much, moderator. First of all, I would like to appreciate, on behalf of Malawi government, the partners in population and development for incorporating us into partnership during the board meeting, which was held yesterday on 7th July 2024. We anticipate good collaboration as we together collaborate for achievement of specific global goals. But before I get into my presentation, let me first just give a brief background or statistics about Malawi. Since we are a new kid on the block, you need to understand which country you have incorporated into the partnership. Malawi is a landlocked country in the southeastern Africa, with an estimated population of 21.4 million. This is as of this year, 2024. And we estimate that by 2050, the population will double in the country. So currently now we are at 222 people per square kilometer. So you can imagine that by 2050, how many people will be, what will be the population density. Now, currently, the population growth rate is at 2.6%, and the median age is 18, with life expectancy of 63 years. Now, if you look at the distribution of the population currently, below 15 years, we have 45% of the total population, and about 49% of the population is under 18. That also suggests as to how much of the productive population is there in the country. Now looking at the statistics of the SRHR, the total fertility currently has been reduced to 4 children per woman's lifetime. It was 6.7% in 1994, so we find this as a reduction, the way we are counting at 4 children per woman. 133 births that are registered in every 1,000 births are for women between 15 and 19 years. So you also see that there's a kind of early births in the country. Maternal mortality has been reduced to 349 per 100,000 live births, while under 5 mortality is currently at 42 per 1,000 live births as of this year, 2024. Now, Malawi government acknowledges South-to-South triangular cooperation as a crucial approach for achieving global development goals. When it comes to promoting sexual and reproductive health and rights, SSTC provides a unique platform for collaboration, knowledge exchange, capacity building among developing countries. There are a number of areas where, as countries, we can leverage the SSTC mandate. I'll mention 4 of them. The first one is capacity building and knowledge exchange, where we know that developing countries often face similar challenges in the field of SRHR, and this collaboration provides a platform for multi-country exchange and sharing of knowledge, good practices, innovative approaches, and lessons learned. Now, through this South-to-South cooperation, countries can learn from each other's experience in promoting comprehensive sexuality education, expanding access to family planning services, and also addressing maternal and child health concerns. Now, on capacity building, we believe that PPD is well positioned to establish a center of excellence where professionals in the subsector can participate in short and long-term courses. Furthermore, PPD can also facilitate fellowship programs, allowing personnel from different countries to be placed in other institutions for learning opportunities, while also maintaining scholarships for member countries. The second way where we believe that we will be able to leverage the SSTC among the collaborating partners is by adopting best practices. Now, through the SSTC, countries can identify and adopt best practices in promoting SRHR. We know that successful initiatives in one country or innovative approaches to adolescent reproductive health can be adapted and implemented in other countries which have similar contexts. I'll give a few of the best practices that we know that Malawi we have managed to achieve currently. we have increased the coverage for youth-friendly health services to about 85% of our health facilities, from around 20% in 2015. So with that regard, access to sexual and reproductive health rights services have significantly improved nationwide. We believe that other countries can also come and learn from our experience. Additionally, traditional leaders in our country have played a key role in addressing harmful cultural practices like child marriages. I just noted that our previous speaker mentioned about early marriages, and this is also the case in our country, Malawi. But our traditional leaders have played a great role in addressing such. Because of that, there's been significant decrease in child marriages, and we have also managed to nullify some of the early marriages in different areas of the country. Another notable stride, the Ministry of Education in Malawi incorporated SRH matters into the senior primary and junior secondary syllabus to ensure that young people have access to this kind of education at an early age. There's also male involvement in promotion and delivery of SRHR, where husbands are encouraged to escort their wives to clinics because it comes with an incentive. Whenever a woman goes to the hospital for a service, if they go with a husband, they get a fast and quick service at the hospital. So it has also increased access to such services. The third point is resource mobilization and partnership. We believe that we'll be able to benefit. There are other countries which have made significant strides in promoting SRHR, and partnering with these developing countries, we can access technical expertise, financial resources, in-kind support. We can even strengthen health systems, build sustainable solutions for SRHR challenges which exist in different countries. And we believe that SSTC will create an enabling environment for pooling resources, leveraging technical assistance, and fostering partnerships. Finally, we consider policy dialogue and advocacy as an area where we know that the SSTC will enable countries to undertake policy dialogue and advocacy at regional as well as global levels through platforms which will be facilitated by the SSTC. Countries can collectively advocate for SRHR as a fundamental human right, be able to share priorities and challenges, and also influence global agendas related to SRHR. In conclusion, we know and believe that this cooperation, the South-to-South triangular cooperation, is a powerful mechanism for advancing sexual and reproductive health and rights worldwide. By fostering collaboration, knowledge exchange, resource mobilization, policy dialogue, SSTC will play a pivotal role in strengthening the health systems, also in promoting gender equality. It will help in improving SRHR outcomes in developing countries. So as countries who are together in partnership, we continue to harness the potential of SSTC. We'll be sure that there will be a realization of universal access of such services and the achievement of global SRHR goals to be able to be feasible in our respective countries. But before I sit down, I will just mention a few of the challenges, because that's one of the areas where we needed to also touch. What challenges are there that might affect our achievement of the SRHR goals through SSTC? One of the major challenges is the diversity of cultural and regional contexts within our countries. This can pose a challenge in implementation of SRHR initiatives, because we know that this area is still sensitive in most of the countries. Therefore, attitudes towards the issues of such as family planning, gender equality, even sexual education may vary, and it requires tailored approaches to these problems. For example, a study revealed in our country that 80% of women indicated that they know that they have a final say in decisions regarding their sexual health. But only 30% of the women were actually able to make their own decisions. Because in families, women will still follow a man's decision to undertake any regarding sexual health. So there's need to develop a culturally sensitive approach that respects diverse beliefs and practices, and to be able to tailor these SRHR programs to specific cultural beliefs and religious contexts, so that we'll be able to have or register gains in our efforts. The next challenge is resource limitations, where we see that not every other country is able to achieve their activities in SRHR because of limited resources available. So as countries, we might need to collaborate to mobilize resources from the traditional and traditional partners to ensure that our efforts realize its benefits. Finally, another challenge is that of policy alignment. There is misalignment of certain policies in different countries. We need to harmonize our national policies so that they should be able to have a cohesive and a coordinated approach to SRHR. Thank you very much.